And let's get to the on-air studio with Dr. Ed Aleo. Good morning.
Good morning, Dan. How are you?
Good.
Hey,
Excellent.
Dan,
Top of the morning.
I don't know if you noticed, Dan, but it's an outstanding sunrise today. Sky is beautiful out there.
Yeah, I catch a little of it just as I'm coming down the steps to get to the car.
It's coming up now.
Yeah.
It's really nice. Anyhow,
Yeah.
thanks for having me, Dan.
But you're right. It's coming later. The
right.
sunrise is coming
That's
a little
right.
later now.
And the sunset is earlier. That's sad.
Yeah, that's true. Yeah,
Okay.
shorter days.
Well, today, somebody asked me to do something on hearing. So I thought I would do something in a little academic and also clinical about hearing, a little different than what people usually talk about, and have a little fun and see what happens. Okay, Dan? So, one of the things, just a little bit of trivia here. I don't know if you knew this or not, Dan, but did you know that humans are born with only two fears, supposedly? One is the fear of falling and loud noises. You get a reflex. It's called a reflex center. So everybody,
that's interesting right off the bat.
All other fears are learned, supposedly. So I thought that was interesting. Another piece of trivia for people who are brain-oriented, and that is that the average person produces as many as 12,000 to 50,000 thoughts per day. Now, that depends on what kind of thinker they are, Dan.
Or how many dreams they're having.
Or what? Or
Daydreams.
Or both. So I can't imagine myself
150,000 thoughts a day. That's probably true, come to think of it.
I don't know what a thought is. Maybe it's like, oh yeah. Or is it something more?
Probably a new, I guess a thought would be a new process of thinking that was different than the last one.
Yeah, I can't see myself having 50,000, even 12,000. But anyhow, that was a piece of trivia that I found, and I thought it was interesting for all those thinkers out there. How's that? Another thing that is happening with the pandemic, people are all into statistics. So I thought I'd pull up some statistics regarding hearing. So for the listeners, supposedly, and this is a statistic that I found, 17% of the population, which is of our country, which is about 42 million people, have hearing loss that can be treated somehow. And the U.S. population is 328 million people, and 10.6% will give you that number, approximately that number of 34 million people. In New York State alone, we have 19,500,000 people, and if there's 10.6% of those people have hearing loss, that's 2,071,000 people need help. And we talk about help, we're usually talking about nerve deafness, Dan. When nerve deafness is different than an infection in your ear or a sinus problem. That still causes some kind of reduction in hearing.
But it's temporary, I guess, right? It's
But
acute,
not
temporary. Yeah, right.
It's not permanent. So those people usually look at amplification or hearing aids to help solve their problem. Another statistic, just to give you a difference between states, we have 19.5 million people in New York State. North Dakota has 760,000 people. We have more people with hearing loss in New York State than they do population.
Right.
760,000 people in North Dakota, and we have 2 million plus people in New York State that have hearing loss.
Yep.
Pretty interesting, huh?
Very populated state.
And look how big that state is per square mile compared to us.
We've got,
Anyhow,
there's Buffalo and there's, but it's North Dakota is very agrarian.
Yeah.
And I would venture to say that the population of North Dakota has a lower percentage of hearing loss people than New York. It's possible because of the urban noise and things like that. What do you think?
Well, it's interesting. That's a good point. But generally speaking, it's an age-related thing. So it's the same number, the same percentage of people across the country have hearing loss. So if we say 10% again, they would have about 80,000 people who need help.
All right.
But interesting enough, back to New York State, we have 2 million plus people who could use amplification, for example, and there's only 1,400 plus audiologists. And
I don't think you can cover that, right?
You cannot cover that.
Oh, geez.
And there's 325 plus hearing aid dispensers. Those are people who are, it'd be akin to audiology, hearing aid dispenser, sort of optometrist and optician. So they'd be like the optician part. But the point is that at one point, years ago, there were something like less than there were a number of counties that had no dispensers or audiologists in them years ago. It's better now, probably one person. So all those professionals are in the cities, like New York City, Long Island,
Right.
Westchester,
Buffalo, maybe, yeah.
Buffalo, Albany, and then you go up north in the Adirondacks. There's probably more bear than people. Sorry, folks. And there's less providers for them.
Uh-huh.
So I thought, interesting statistic.
Very, very interesting and somewhat unbalanced, of course.
Yeah, of course.
But as we baby boomers are emerging into older age, it's showing it up
Of course.
exponentially, I guess.
And that's what happens.
Yeah.
The baby boomers are the people who are more inclined to have the hearing loss and also seek out help. Not everybody seeks out help. The reasons patients are unsuccessful with hearing aids is they tend to think hearing aids versus cognitive processing. By cognitive processing, it's more of a function of there's more to solving hearing loss than hearing aids. There has to be a rehabilitation program. There has to be a medical treatment program to help people do better. You have to stimulate the brain a little bit, not a little bit, you have to stimulate the brain, and that helps with cognitive processing. Without that, you have decline of hearing, you have a decline of processing or cognitive processing.
So there's a round of therapies. There's a kind of a syllabus of therapies that go with getting a hearing aid.
Yes, there is.
Yeah. Okay.
And it's interesting that people, even today, think that they can wear one hearing aid when they have hearing loss in both ears. So that's one of the negatives to trying to help get better, hear better, or process better. And I'll explain why later when I talk about how processing works. But so you got to wear two hearing aids when you have a hearing loss.
Right.
In
Otherwise,
both ears.
you won't know where things are. Where sounds are coming from.
That's
too.
one thing.
You need both ears for that.
Yeah. You need both ears for localizing. You need both ears to hear in background noise. And here's one for you. Everybody in the audience can try this one to see if I'm right. If you're driving in your car and you turn your radio on, you roll down your window, and then there's noise. So noise interferes with processing, especially if you have a hearing loss. But if you don't have a hearing loss, you still have difficulty with background noise. So what you do to find out if I'm right, you put your finger in your left ear, which is the window side, and listen to the radio and listen what happens. The noise will tend to overshadow the speaker or the radio, and then if you take your finger out of your ear simultaneously, you'll hear clearness of the speech, which proves that one ear isn't as efficient as two ears in reducing the effects of background noise in conversation. The other problem that people have with hearing aids, which is a big mistake, is they wear a hearing aid one day and not the next. In other words, you have to adjust neurologically to hearing aids. So the big fallacy is, well, I don't need them that much. Big mistake. As soon as you have hearing loss and you need hearing aids, you need to wear them all the time, every day, all day.
Yeah.
But you have to work up to it. In our practice, there's a wearing schedule. You start out with 2 hours a day, and you start at the end of the day, say at 6 o'clock, you wear it till 8 o'clock. You do that for a number of days, and then you wear it 3 hours a day. You start at 6 and wear it till 9, 6 till 10, and then you back into the day. You start at 5 to 10, 4 to... You don't start in the morning and walk outside. That's a big problem for many, many people. I'm talking first-time users. So what happens, they go outside and they're overwhelmed. The other part about your brain is even though you can hear better with hearing aids, you are overstimulating your brain in this sense that hearing aids, let me say a good analogy would be this, Dan. If you're stimulating your brain constantly with new stimulation, the hearing aid, you fatigue. By fatiguing, I mean it's either too loud, you're wearing it too long, and the results are similar to being in loud music or loud noise for a long time.
We call that in the audio engineering world ear fatigue, because of you've been listening to mixes and working on mixes all day long. You have to take ear breaks.
Well, let me explain why.
Yeah. Okay.
The reason it happens is like in your profession, or anybody, even if you were a carpenter working in loud noise, or people working in the gym, they have loud music on. It increases heart rate. It increases respiration, and it constricts blood vessels. That's called a headache. So people who wear hearing aids will say to you, old people, they say, well, the hearing aid gives me a headache. And you go like, that doesn't make sense. But that's what happens. When you constrict blood vessels, you get pressure. So, and the last thing that makes them not do well is they constantly adjust the volume of the hearing aid, or they adjust the programming. So they never settle into getting used to it. So if they have what I used to do is I would limit the ability to adjust the loudness, the volume.
Sure, absolutely.
And then I would give them one program only for the first week or two, and then let them add, because you can get 5 programs. That's too many programs for anybody. It's a program for listening to music, program for TV, program for restaurants.
Oh boy, okay.
Constantly pushing buttons. So anyhow.
Yeah, and our ears don't do that, but our brains do.
Yes, that's right.
Yeah.
And your brain can keep up. Your brain can keep up with that, but your hearing aid can't, so to speak.
Right.
So anyhow, as good as they are. And the other thing that's of interest with hearing loss and people is a comorbidity. We all talk about comorbidity with the onset of the pandemic, but there's a comorbidity with regard to hearing loss. Often with age, patients experience, other problems like diabetes, cardiovascular disease, which constricts blood vessels. By the way, if you have cardiovascular disease and it constricts big blood vessels, your ear, which is the cochlea, has little teeny tiny thread-type blood vessels, and if they get constricted, that impacts on your ability to process within the cochlea. So there's a problem. Dementia.
Wow.
Dementia is also a problem as you get older. The cognitive decline. And here's one interesting one that people never think about, and that is with hearing loss. There's 2 parts of your ear. There's the balanced part of your ear, and there's the hearing part of your ear. And
so the balanced part is that swirly little snail-shaped thing called the cochlea, right?
Well, the cochlea is the hearing part of the ear.
Okay, sorry.
That's right.
No, we've got the
semicircular
canals.
Good for you.
That's the part that's for balance.
So we're going back to high school anatomy, which is your semicircular canals, which causes your balance, and one part of your balance system, and the other part of your balance system is the back of your brain, which is the cerebellum. That's a neurological balance. So one is a balance system from your ear, and then you have the cochlea. The cochlea is for hearing.
Right.
So as you have a decrease in hearing, oftentimes there's subtle decrease in balance system. So people who have severe hearing loss or more hearing loss tend to have more of a balance problem, and they never think about the two being related at all.
Very related, aren't they?
Yeah.
Yes.
It's it's called the vestibular system. The semicircular canals is the vestibular system, and then there's the cochlear system.
What I've always I've taught acoustics and things like that, and one of the first things that you teach about is how the ear works. But one thing I've always been mystified by is why our ears are the center of balance. Why our ears are the center of balance for our body. That's fascinating to me, where the connection is. What's the connection?
We can talk about that we can talk about that too. But again, your semicircular canals, the vestibular system, is the center of balance, and that's in your ear. So it's when you tilt your head one way, that's one semicircular canal. You bend over, so there's three of them. There's a superior, a horizontal, and a posterior semicircular canal. Mm-hmm. And when people become dizzy, the posterior and horizontal canals are sometimes involved, and people start to spin around. So people who are dizzy and spin, who have vertigo, we usually look immediately at their ear. If they're lightheaded or they shuffle their feet when they walk, that's your brain. So they say they're dizzy. So everybody says dizziness, but what is it? Is it vertigo? When you turn, you get dizzy. When you roll over, you're dizzy. Those are dizziness problems. Those are vertigo problems. That's an ear problem. Mm-hmm. So there's different aspects of this, but. Anyhow, comorbidity increases with age. As comorbidity increases and you have hearing loss, the more you run the risk of what they say dementia, because you can't process. So you have with comorbidity, or some of the comorbidity is depression, anxiety, isolation with hearing loss. People who have comorbidity also have they may have kidney disease, thyroid disease, cancer, heart disease, mental health problems, HIV, AIDS, malnutrition, substance abuse, bladder control, constipation. All those things come into play. See,
wow,
with aging.
Right, and that's oftentimes why like certain patients have a fall warning. Like that some patients might fall easier than others, and would definitely the dizziness and that kind of sense of not being balanced would be playing into that warning.
So let's take this direction. This will be good. You'll like this one maybe. With your balance system is two parts. Your ear, like I said, semicircular canals, and the other part would be your cerebellum, the base of your brain. Okay, so things that make people unbalanced as you get older would be carpet. Now, this carpet is solid on the floor we're at. If you get mushy carpet with lots of filler underneath it, people who have balance problems from their brain have a hard time walking on it. They become very unsteady. Or even if you're people who are in a boat have both problems, because if they have an ear problem and they're getting older, when you get on a boat, you lose your proprioception, which is orientation of yourself from your base of your brain, cerebellum, and your body, knowing where your body parts are. Mm-hmm. See, that's an orientation. So if you have an ear problem, you stay up three ways, Dan: your eyes, your ear, and your proprioception, your brain. Uh-huh. So when people have vertigo and their ear is a problem, what happens to them is when they get on a boat, for example, they lose their proprioception and they get sick.
Sure.
Or if people drink a lot, here's one for you: drunks, when they drink too much, the first thing people do when they're dizzy is they close their eyes. When you close your eyes,
you lost one of the elements of keeping balance.
Your eyes, ears. And so what happens, they end up vomiting. Mm-hmm, mm-hmm. So one of the secrets, not for drinking necessarily, but I guess it would work for drinking, would be if people are dizzy, spinning dizziness, if they were to look at something like their thumb, keep their eyes open, it's really hard to do because your reflex, one of those reflexes, is to close your eyes.
Interesting.
And you get more dizzy.
Yep. Mm-hmm.
So
I've noticed that many times on the sailboats.
Yeah.
People who have a tendency for seasickness. I mean, there's some great remedies, but the worst thing to do is to go down below.
Right, because you lose your vision.
Yes, you lose your sense of what's causing these movements, and what I do oftentimes is if somebody's feeling a little nauseous, I give them the tiller. And then they're responsible for the motion of the boat.
That's
and
the same
it helps.
the same thing with driving. When people drive, Dan,
Yeah.
what they do is if you're the driver, you don't get as car sick. Passenger or back seat, same as what you just talked about.
Right.
See?
My daughter used to get car sick in a bus if we were taking a bus trip or something, and they always allowed her to sit in the front.
Yeah, that's how it works.
Yes, right.
So those are some of the interesting things about hearing loss, and also we talked about dementia. But if you have hearing loss, if you don't stimulate the ear with hearing loss, the less you use your ear because of hearing loss, the worse it gets. Not the hearing loss doesn't get better, but your inability to cognitively process
That's fascinating.
or to hear in background noise becomes a problem.
It's not
So
just
lack
about
of stimulation.
Yeah, it's not just about adding volume.
Right.
Yeah.
Right. It's not about volume. So lack of stimulation or lack of improvement to the cochlea, it works its way up to your brain, which is your central auditory cortex. So there is a trip up there, so to speak, from your ear, which is the cochlea, that snail thing you talked about,
Yeah.
to this part of your brain right here, which is the central auditory cortex.
That was the left. He was pointing just above the ear to the left side of the brain.
Right.
Yeah.
But it's on both sides.
Yeah. Okay.
That's good.
We're symmetrical there.
Yeah, there we go. Hearing loss is a degenerative process. It doesn't get better, and with age, it usually gets worse. So anyhow, that's interesting. Let me just talk for a second about how this works because we're running out of time. This is kind of unique, and if you're a little bit of on a science part of it, you might find it interesting. But the cognitive processing neurologically works like this, Dan. You have that snail type aspect, which is called the cochlea. We're going to call that stage 1.
Good.
It's easy.
Yep.
So what that does is it sends information to the first stage 1, which is the cochlear nuclei, whatever that is. But that does temporal coding. Temporal by time, I mean. It's a timing thing. So that if you have hearing loss, and it's a high-pitched hearing loss, and people have problems processing right out of the cochlea to this first stage, what happens is some of the things that happen to them is that they miss the beginning of words or the ends of words. So they're the people who sit there and they're listening to you, but they're chasing the conversation. So they just become a lump and they stop participating in talking.
Because they're not hearing the consonants and things like that.
Well, they don't hear the first part, which could be a consonant.
Okay.
And they don't hear the last part of words. So they're thinking, what did he say?
Okay.
While you're thinking about what's being said, the conversation's going on. And they finally stop listening, so to speak. Stage 2 is another area called, it's called the superior olivary complex. Nice word. But that analyzes or filters auditory information. So it's a filtering system. So it has a binaural, 2 ears. It has a 2-ear integration. Okay, so that helps in helping people to hear in background noise. So that system, the superior olivary complex, helps you in background noise. But if you have a defective cochlea, the snail part of the ear, then you're not able to hear in background noise without some kind of correction. The third stage is another good word. I like this word, inferior colliculus. So we'll call that stage 3. It's a backup to stage 2, and it's responsible for sound localization. Remember we talked about that?
Yep.
That's the binaural integration. So if you have a problem with the cochlea, now you miss first parts of words, you can't hear in background noise, and now you can't tell where sound's coming from. Pretty cool, huh?
It's phenomenal how many stages there are after the cochlea.
Right. It's
That's
called
phenomenal.
central. It has another term called central auditory processing. So the stage 4 Another nice word. I like this word best of all, Dan. It's called medial geniculate body.
Okay,
Wow.
menial geniculate
Geniculate body.
Okay.
So it's the output connection. It's a relay station between stage 2 and the auditory cortex, which
yes.
is your brain. So that's the other stage. It's called stage 4. It's a fun word, medial geniculate body.
I am schooled. Thank you.
Here you go.
I
Here you
am
go.
very, very schooled. I wasn't aware of so many neural stages that were going on
Isn't
between
that
the
fun?
cochlea and
Yeah.
the neural canal. You know, the we call it the auditory nerve.
Yeah.
Yeah.
The auditory
Simply.
nerve is different from all those. The auditory nerve is from that snail going out.
Okay.
That's where you go to the first one.
Oh, okay.
Stage
So
1.
the other 4 stages are actually happening in your brain.
It's all the way up from the
Okay.
base of the brain.
Gotcha.
So the stage 5 is your auditory cortex. That's up here in the cerebellum. So that one, and there's a lobe, your parietal lobe right here, side lobe, and that's that's where Herschel's gyrus is. That's the primary auditory cortex. And Dan, I'm going to leave you with this one. You'll love it.
Okay.
The last stage is Wernicke's area. That's responsible for comprehension of speech. Isn't that cool? So you went from the analysis of sounds at the cochlea to interpretation and comprehension at the auditory cortex, which is Wernicke's area. What do you think, Dan? I lost him.
I think we're good. I think that's phenomenal. You know,
I know.
didn't have a cue on.
I know. I saw that.
Okay.
That was pretty. So I know that was a quick analysis. Nobody ever thinks about that. Not even the professional, not the doctors. They just think you hear and you don't hear.
Exactly.
But if you don't hear well and you have a defective ear, meaning the cochlea, the snail, then other things happen in processing language, speech, and that's where dementia tends to creep in. And another time we can talk more about dementia. They wanted me to talk about hearing. I thought this was a fun thing to do.
Absolutely. That was such a phenomenal rundown. And
glad
very,
you-
very enlightening.
Well, you were a good audience, Dan. I couldn't